especially if they got it wrong. Now, in order to get a better understanding of this, I want to bring in someone that is well-trained in emergency medicine. Dr. James Neuenschwander is joining us now. Dr. Neuenschwander, the first question I have, and first of all, thank you for joining me, is I think for most of us, what he describes at the end of this video is that he's moving into a different protocol to use oxygen first. My understanding was a ventilator is oxygen. So for those out there that are maybe missing the significance or the detail or the difference between them, what is the difference between giving oxygen and using a ventilator? Can you take me through that process?
Sure, Del. So you can deliver oxygen in a number of different ways. A ventilator is just one way to deliver oxygen. And the difference between a ventilator and just having a nasal cannula or a face mask is that this is still using your own respiration. You're breathing the air in, you're creating a negative pressure, you're sucking the air into your lung. When you use a ventilator, you're pushing air into the lung, and that creates a completely different dynamic. The other thing is, once you paralyze a person, now you're completely depending on that ventilator to do all the breathing for them, and it's very much dependent on how you set up that ventilator, and that's what he was talking about in terms of maybe we're setting this up the wrong way.
Very interesting. You know, and I want to point this out. He is no longer all alone. I mean, this was just a few days ago. It was the first that I've heard of it, but now we are seeing a report. This was just in the Chicago Tribune yesterday. Let me read this. Some doctors are moving away from ventilators to treat coronavirus patients. The reason? Unusually high death rates. It goes on to say, as health officials around the world push to get more ventilators to treat coronavirus patients, some doctors are moving away from using the breathing machines when they can. The reason? Some hospitals reported unusually high death rates for coronavirus patients on ventilators, and some doctors worry that the machines could be harming certain patients. Generally speaking, 40 to 50% of patients with severe respiratory distress die while on ventilators, experts say, but 80% or more of coronavirus patients placed on the machines in New York City have died, state and city officials say. Now, why would they be dying? I mean, so first of all, what damage can be done by a ventilator that's not done by oxygen? What are they talking about? What are the risks that, you know, all of them? What drugs are being used? What is the process of putting someone on a ventilator?
Well, typically, you're going to give somebody some type of sedation. You don't really want them awake. You're going to paralyze them, and that's one of the biggest reasons to give sedation. But you're going to paralyze them, and then you're going to put the tube down their throat, and you're going to put them on the ventilator. Now, once you're on a ventilator, you usually have to have pretty heavy sedation. Otherwise, you're going to be fighting this thing. So once that tube is down and you're putting that pressure in, the idea is you're trying to minimize the pressure you're using to get the job done. Because the higher the pressure is, the more likely you are to damage those lungs. I mean, the lungs are kind of delicate tissue, and you don't want to get too much pressure. Now, what they're talking about and what he is talking about is different treatment protocols. They're treating this early COVID when they're being put on ventilators as though it is like ARDS, which is sort of an end stage of a typical pneumonia kind of infection. And what they're saying in these studies is it doesn't look like that's what we're seeing on CAT scans or what you're seeing on physical exam. So the pressure that they're using can damage the lungs, and that may actually make the situation worse rather than better.
Is there, you know, so when we reached out to you to start looking into this, you know, of course, this is brand new. This doctor could be wrong. I want to make that, this is brand new, a breaking story. But for those of you that are following the High Wire for the first time, we investigate with you. We are not going to come to the answers, then just bring you the answers. I am talking to Dr. Neuenschwander really for the first time. We like to have the investigation out in front of you. We have an MD in New York that's demanding that the international body of scientists come together and try and help with this issue. Now, when you heard that things that he was saying, that I don't believe this is a pneumonia. I don't see fluid in the lungs, that there appears to be much more flexibility to these lungs, that they don't have difficulty moving their lungs, which is why you would use a ventilator. They seem to be starved of oxygen. What were your thoughts on that, and where did you look to try and see, is this a different type of illness?
Yeah, well, it turns out that one of the doctors that was involved in northern Italy, in the outbreak in northern Italy, Dr. Gattinoni, actually published an editorial piece in one of the journals, and he showed differences in the CAT scans between these patients. So when you typically look at a CAT scan from a patient that has classic ARDS, which is what all these protocols are for, their lungs have fluid in them. They're whited out. There's a lot of heaviness to the lungs. But you look at the CAT scan of patients that are in the earlier stages of COVID, where they're short of breath and they don't have very good oxygen saturations, and their lungs don't look that bad. They're dark on the CAT scan. There's plenty of oxygen. The entire lung looks like it has air in it, and it's not all collapsed and full of fluid. So he actually published that probably a week ago. It's just, it takes time for this stuff to come to light, and there are just paper after paper after paper every day trying to figure this out. So you have to go back to, all right, we are assuming that the problem is with the lungs. The lungs are not exchanging gas the way they're supposed to. And that's where you start using a ventilator. And remember, we are trained as doctors, when in doubt, intubate. Intubation is the safest thing you can do. Now you have control of the airway, you have control of the lung, you have control of the oxygen. So we have to fight against that training in this situation. And we have to be willing to put up with a patient that has lousy oxygenation. So what he was saying was, if it's not the lungs, what is it? And
in fact, and I know that we just saw, you forwarded this to us, this study out of China. Can we see this headline really quick? I believe this is still under peer review, but obviously in China now, a study come out. COVID-19 attacks the 1-beta chain of hemoglobin and captures the porphyrin to inhibit human heme metabolism. It goes on to say this, that can we bring up the next slide? Okay. At the same time, ORFLAB, a lot of this I'm going to have you explain. ORF10, ORF3, F3A proteins could coordinate attack the heme on the 1-beta chain of hemoglobin to disassociate the iron to form the porphyrin. The attack will cause less and less hemoglobin that can carry oxygen and carbon dioxide. The lung cells have extremely intense poisoning and inflammatory due to the inability to exchange carbon dioxide and oxygen frequently, which eventually results in ground-like lung glass in lung images. I mean, it sounds like, if it just from my perspective, and perhaps you can give me a better understanding, that this may not exactly be a respiratory issue or a respiratory disease, but something more like a blood disease. Am I getting that correct?
Right. So the whole idea behind the heart, the lungs, and the circulation is to deliver oxygen to tissue. Tissue needs oxygen to work. That's what we use for our respiration. Without oxygen, eventually the tissue is going to die. So that is the whole function of this system. Now, we're looking at the lungs because we're assuming this is a viral pneumonia. That would make a lot of sense. But what we're saying here is that that particular paper now gets a little bit complicated, but inside the blood, you have something called hemoglobin. This is inside your red blood cells. And the vast majority of all the oxygen in the blood is carried by hemoglobin. It's not just dissolved in the blood, it's carried by hemoglobin. So hemoglobin is made up of these heme particles. There's 4 of them. And what they're saying in this paper is that the viral glycoproteins actually displace the iron out of this heme protein. Iron is the critical ingredient. If you don't have iron, you cannot carry oxygen in the hemoglobin. So it displaces the iron. That creates a lot of free iron, and that can cause problems. But it also creates hemoglobin that no longer is hemoglobin. It can no longer carry oxygen. And what's interesting is you have something kind of like this that happens in malaria, and this is one of the targets of Plaquenil. You know, Plaquenil or chloroquine, hydroxychloroquine, they will actually displace the malaria drug, the malaria protozoan off of the hemoglobin so that it maintains its structure. That is one of the theories as to why the Plaquenil helps here. It keeps the heme intact in that hemoglobin so it can carry the oxygen. Because without it, your oxygen's going to plummet. So,
Now,
again, there's